Here's a quick example of how a medication reconciliation should be completed. So, you find that Lucas is from home. This is what the patient's medication list should look like in Epic. The medication list prior to admission is under the medication document section in the left-hand sidebar, then under med document in the prior to admission meds. The patient's main pharmacy or pharmacies should be listed under the pharmacy button here. And when you click the button, it should expand information to give you the pharmacy's phone number and fax number. What should you do next? Fax this Walgreens with a TOC cover sheet requesting the patient's medication list.
So, 45 minutes have gone by, and you're starting to wonder, was my fax at Walgreens tossed in the garbage, or did they just forget about it? You should call Walgreens to confirm they have received your fax and kindly request them to send it as soon as possible. Several minutes later, you receive the fax from Walgreens. Walgreens is one of the retail pharmacies that doesn't fax over quantities of medications picked up, so you'll have to call to get a verbal of the quantities. Compare the patient's medlist in Epic with the medlist Walgreens sent to see what the discrepancies are. On the medlist from Walgreens, you see that the patient picked up Norco and metformin, but these medications do not show up on the patient's medlist in Epic. Also, the patient's medlist in Epic has calcium carbonate, but is not listed on the Walgreens list. Lastly, Walgreens has records of Lucas picking up lisinopril 2.5 mg, but on the medlist in Epic, it lists lisinopril 20 mg. Make a note of these to ask your patient.
Now it's time to go interview the patient. Here's a quick example. Hello, Mr. Chang. My name is Katie, and I'm the student pharmacist. This will only take a few minutes of your time. I'm here to go over the medications you're taking at home so that we can continue to optimize your care during your stay here at the hospital. Is now an okay time to go over your medications?
Yeah, now's a good time.
Do you take care of your own medications?
Yes, I do.
Do you happen to have your medications or a medication list with you?
No, I actually left that all at home.
That's okay. We can just talk about your medications right now. Do you take anything for your blood pressure?
Yeah, I take lisinopril, and I also take a medication. I know it starts with an A, but I can't remember the full name.
Is it amlodipine?
Yeah, amlodipine, that's it.
How do you take both your blood pressure medications?
For the lisinopril, it's 2.5 mg, and I know I take one tablet once daily. And for the amlodipine, it's 10 mg, and I take one tablet once daily.
Let's talk about your diabetes medications now. What do you take?
Glipizide, 5 mg, and that's one tablet twice daily. And metformin, 1,000 mg, and I take that once daily.
Oh, I see from the fax at Walgreens that it says twice daily for your metformin. Is there a reason why you take it only once daily?
Yeah, so some of my other friends, they take metformin, and they said they get really bad side effects from the metformin, so I didn't want to take it twice daily.
Oh, okay, I see. So let's talk about your inhalers right now. I see that you have 2 inhalers. What are they?
I have one inhaler called Spiriva that I take once daily, and I have another one that I take as needed called ProAir.
Can you tell me how you take your inhalers?
For my Spiriva, I take one inhalation once daily, and then for my ProAir, I take it as needed, so whenever I need it.
So for your ProAir, on a really bad day, how often do you have to take it?
2 times max per day, and that'll be 2 puffs each.
Do you take Docusate?
Yeah, I was taking Docusate a few months ago and the Norco for my broken arm, but I haven't taken it for the past month.
How about vitamins?
I do take a calcium carbonate supplement.
What's the dose on the calcium carbonate?
The strength is 500 milligrams, and I take one tablet twice daily. And I also take a men's multivitamin.
And how often do you take your multivitamin?
One tablet once daily.
Did I miss anything else? Any prescription medications?
No, that's all of them.
Anything over the counter?
Besides the multivitamin, I do take one Claritin for my allergies.
Okay, what's the strength?
It's just your normal Claritin.
And how many times a day do you take it?
I just take one tablet once daily.
How about any patches or lotions?
No, none of those.
Eye drops or ear drops?
No.
And lastly, herbals.
No herbals.
Thank you for your time, Mr. Chang. Take care.
Thank you.
After the interview, you will compare this newly reconciled medication list with what the patient was started on in the hospital and report your findings and recommendations to your preceptor.